Our next project is about animal health and well-being. After we hear about this one, then we'll have another Q&A session followed by light refreshments. So this team combines expertise in veterinary science, environmental health, and food security. And they've been focusing on a piece of California legislation that took effect this year to limit the use of antibiotics in the production of animals for food. So you think, well, what's not to like, right? Everybody wins. However, it could be more complicated than that. The team has been interviewing poultry and dairy farmers about what is actually like, what it is actually like for them and their animals to be subject to this legislation. And I'd like to just go ahead and ask the presenter or presenters to go ahead and start, because we want to hear what you've been learning. And please, go ahead and introduce yourself. Oops, I'm going to break my rule here just to save time.
Hi everybody, I'm Dr. Meghan Davis, and I love that we've been kind of placed in a duet with the last presentation, because I think there are some themes that will emerge that are interesting, and also because I'm a Baltimore native, and I just love that project. So I'm voting with my blue card. Okay, who eats? Yeah? Come on, let's go. Participation? Yeah, great. Who doesn't eat? There were some hands that didn't go up. All right, I'm on to you. Eating is something that we do, and it doesn't matter if you eat meat or don't eat meat. You can be impacted, potentially, by some of the bacteria that come from animals, even if you're eating simply vegetables. Because, of course, we have an entire food system where we recycle, we'll just say manure, into some of our crop production chains. And so you can be exposed to bacteria that come from animals. When we fed those animals antimicrobials, whether it is for disease treatment or disease prevention or growth promotion, we select for resistant bacteria. And this can make any infection that we get from exposure to these bacteria much more difficult to treat. And so there's been a lot of focus in public health on how we combat antimicrobial resistance, and some of that attention has been targeted at reducing uses of antimicrobials in animals. This can also have impacts on the farmers who produce the animals. So who here knows a farmer? Raise your hands. Okay, that's a pretty good number. Keep them up, and then you can put them down if the next questions don't apply. How many of you have worked with farm animals? Okay, there's still a couple folks. Who has a farmer in the family? Yeah, very few, but a couple. And this is pretty representative of our current demographic in the US. So we are increasingly disconnected from the group of people who grow our food. So let me talk a little bit about Senate Bill 27 and what we're trying to do in this ethics project. And I have a big shout out to our team. So Dr. Barnhill has jumped in, actually, since we originally put in the proposal, and has been really helping us out on the ethical framing. A big shout out to my co-PI, Dr. Jess Fanzo, who is in Rome doing very important Rome work. And then our team. And our team's very interesting. I've got one student in the audience, Dr. Gabriel Innes, who's also a veterinarian like me, and Dr. Catherine Dalton, who's shown with our Aries team, and Dr. Keith Nackman and Chris Heaney, who are also faculty with me in environmental health at the School of Public Health. So what we've done is we have collaborated with a large R01 funded study that's looking to see, do policies that reduce antimicrobial use in animals actually work? Do they reduce antimicrobial resistant bacteria in retail meat? Do they have any impact on human health? And so that's kind of the plus side of the equation. But of course there's always the other side. And here's where we have the tension, the ethical tension between what we try to do in governance to protect the health of the entire population versus maybe some problems and challenges that's going to create with the rights, liberties, or well-being of the individual. And we extend that in this particular legislation that we're interested in to include concerns for the health and well-being of the animals, right? Because as a veterinarian, I have to say that sometimes my colleagues make me a little bit uncomfortable when they start talking about lots of restrictions of antimicrobial drugs, because these are a tool that as a former dairy veterinarian I used a lot. and they were really instrumental to protect the well-being of animals, and not using them could have economic consequences and other consequences for farmers. So we have a situation with lots of different stakeholders. It's very rich, it's very, very interesting and engaging. And one of those thematic areas that I thought was interesting when we're paired with the Archival Justice Project is that we too have participants who express concern about participation because they don't know if they can trust how these data are going to be used. And so this is a really important theme, and I want you to kind of keep that in the back of your head as I share some of our findings with you. So our study is really looking at these norms, attitudes, perceptions on how laws and policies impact all of our stakeholders. And these stakeholders are farmers and producers, and they are also industry professionals, veterinarians, extension agents. I really want to introduce some feed salesmen now based on what some of our farmers have told us. And you know, it's a starting point to inform the design and implementation of future policy efforts. Because if we have public health success in California, then you might expect that as California goes, so too will the rest of the country. And what do we need to think about in this larger national conversation, or maybe even global conversation, about how we restrict these uses? And for those of you who aren't sure what qualitative studies are, they are interviews. And it's not like a little survey where you have check boxes that you fill in. These are a little bit more hypothesis generating. They're flexible, they're emergent. We can do follow-up questions when we find an area that is particularly interesting. And because it does have an emergent design, we have made some changes since our original plan. And the original plan was to look just in California, where SB 27 was implemented on January 1st, and really codifies certain restrictions of antimicrobial uses in food-producing animals. Well, we also had a law passed and implemented on exactly the same date in Maryland that also has many of these same restrictions. And as we were talking to farmers in California, we realized that California is a bit of an oddball state when it comes to policy, because there are many, 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 many policies in California that are not necessarily shared by other states. And so the experience of a farmer in California with this particular legislation is in the larger context of a regulatory environment that's quite different than other states. So we've added Maryland, and we've added some control states, and we've started to try to build out that understanding so that we're going to be better situated to understand the potential implications for a national effort. So California, this is a map of California, for those of you who don't know it. There is kind of a ring of mountains. There's the Sierra Nevadas on the eastern side and the coastal range on the western side. And that's where all the beef and sheep farming is. A lot of the dairies are kind of in the south, right over here, Kern and Tulare counties. And then up on the northern coast, kind of north of where the first folks with the autonomous vehicles took us, to the Bay Area, if you go north of there, you get lots of mixed uses. So you have poultry, you've got dairies, you've got goat dairies, you've got beef, you name it. You've got pretty much everything up in that zone. So I'm going to just give you a quick snapshot of a couple of these areas of production and what we've been learning. So I'm going to start with dairy because dairies are near and dear to my heart as a former dairy veterinarian. And so, you know, what we really heard is that dairies are really, really, really regulated. They produce milk, which is something that we intend to give to growing children, and therefore there's a lot of scrutiny on their processes and a lot of food safety regulations that they have to follow. But they also have to follow a lot of regulations about the environment, how they manage their wastes. They need to follow regulations about air pollution. And now, of course, we have these additional laws that restrict their uses of drugs. And so multiple dairy farmers were explicitly concerned about being overregulated, and one even said, who can handle all these laws? Like, it's a big burden, it's a lot of paperwork for them, and a lot of these are farm families who don't necessarily have like a team of staff who can help them with, you know, regulatory activities. I mean, I think about the amount of activities I have to do for my IRB regulations, and they have to do far more and with far greater consequences. What we did learn is that a lot of the large-scale producers knew about this law many years ago and so had plenty of prep time, and that it really wasn't a big deal for the large producers. But kind of what we heard, again, coming back to that California regulation theme, is that there's some thinking that the number of regulations in California has reached a point of burden where, combined with the economics of milk production right now, which is, by the way, for those of you who don't follow this, it's not good. The margins on milk are pretty bad right now. So one farmer even asked, the family's thinking this is a third-generation family. Are we Californians or are we dairy farmers? Should we relocate to a different state? To give you a beef production perspective, the anti-regulation tone was a little bit stronger in beef production. And I think there are cultural differences between these sectors in terms of the kinds of people who have historically been engaged with these kind of activities. And so one beef stakeholder said, I think often it's just a lack of understanding of the industry, as in that consumers don't understand the industry, that regulators don't understand the industry. And a lack of understanding of the practices of ranchers, but also an increasing problem I'm recognizing is a tendency to view any given regulation in a vacuum. Regulatory agencies have a great way of siloing themselves into what they think is important. And this was true even among small beef producers who were raised without antibiotics ever. And this was not their main source of commercial income. They worked, they did another job, and then they also raised beef because they enjoyed it. And of course, this is what I heard a lot is, who ever thought of this particular legislation? Who thought this was going to work? Where is the evidence? But what I think that offers us is also the opportunity from the scientific perspective. There is a desire to know what is actually the evidence that supports the use of these policies. As a veterinarian, I'm a little partial to the veterinary perspective, so this is my conscious bias. Veterinarians like to think of antibiotics as a tool. And so there were some veterinarians who expressed concern that, the sort of a public discourse and a public decision-making that will, tie the hands of a veterinarian's ability to use a drug is something that takes a tool out of their toolkit and makes it a little bit harder. An explicit concern that this could impact animal welfare. And so what we've been doing in this project is actually trying to capture these producers later and later after the implementation of the bill, because we heard that a lot of them had stockpiled antibiotics that they were able to then use over the course of the first months of implementation. And so they're only just now starting to feel the effects and starting to see problems as they are more restricted in their uses. The other big concern is that not every farmer will have the same experience. And I know from my own time in practice that I had a lot of farmers who would only call me once every 3 to 5 years. They would have a big problem, and that's the only time they reached out for my services. But this law would require that any time they wanted to treat an animal, they would need to have some sort of contact with me, even if it's just by phone, as long as I've been out to the farm in person at a previous time point. And so one veterinarian with extensive experience with these particular kinds of farmers said, my worry is for the left-outs. She called them left-outs. And this is for both the humans, that they're going to have a lot of consequences to this decision, but also that the animals wouldn't necessarily get the care that they needed. So this is the context in which we're doing the work, and this brings us to kind of the ethical frameworks. I'm going to turn it over to Hannah.
Great. How are we for time? Are we?
It's up.
It's up?
Yeah.
Oh, okay. All right. Well, I'll just be really briefly. Yeah. So
I think I'll ask you a question at the end of the Q&A.
Awesome.
And then you can
that's great.
do that. Time's up, right?
Yeah.
Sorry, guys.
All right, so sorry for taking up all the ethics time. So just to wrap up, this has been really foundational to additional work we want to do in order to understand how generalizable this will be on a national scale and to actually bring some of these stakeholders in to help us with decision making. And we have submitted a proposal to the USDA, and hopefully, cross your fingers for us that it will get funded. So thank you very much.
Excellent.